Buster, a 12-year-old spaniel diagnosed with arthritis. Buster's owner talked to us about his diagnosis and treatment.
We noticed that Buster was he was getting rather slow walking around, and particularly when we wanted to get him out of his bed or we called him, he was quite slow getting out, and also he just seemed to be sleeping a bit more than normal. So I originally took him for his annual booster and his checkup, and when we went to the vets they said that they felt he had muscle wastage and that they suspected that he had arthritis. They asked me if we'd noticed any lameness, and I said that I hadn't, because we'd just put him being slow down to the fact that he was now 12. So that's when we kind of looked at the anti-inflammatory medication.
The type of drug that Buster is on is called a non-steroidal anti-inflammatory drug, or NSAID for short. It's a great anti-inflammatory and pain relief and is used for a wide range of conditions, including arthritis, but also for things such as pain after surgery or a painful sprain or strain to a leg.
Buster has the medication once a day. He has it in the evening, so he has his dried food, and then we just put, it's a liquid what we have, so we've got a syringe and we suck up he's 14 kilograms, so we get the correct amount, squirt it on his dried food, and also put a joint supplement in there, and he eats it all, and it can't taste that bad because he's quite fussy, and actually sometimes he'll even lick the bowl.
Anti-inflammatory medication come in quite a few different forms, so liquid, tablets, capsules, injection. It's good to speak to your vet about, which one you think your animal would suit the best, and they'll discuss the different options with you. It may be that only one of them is suitable, but if you perhaps he hates taking tablets, you could request a liquid. In terms of how we use anti-inflammatory medications, we tend to give them daily. That can be adjusted depending on the dog, so you can give them for stints of time, so 1, 2, 3 weeks, and then stop and see how long they can cope without them before they get painful again. That's one way of using them. Generally, these medications, once they're on them for something like arthritis, which Buster is, they're on them for life.
He's been having the anti-inflammatory for about 4 weeks now, and he really has changed. He gets more excited when people come to visit. If he hears the door, he kind of runs about more than he used to, and he just seems a bit more sprightly. He's kind of even jumped off the settee the other day, which was quite surprising, but visitors have commented, can I have what he's having, because everybody has noticed such a difference, so it's a real improvement.
So these anti-inflammatories, when used over a long period of time, can affect internal organs. It is quite rare for this to happen. Generally, when we start a dog on these medications, we'll take some bloods to check whether their internal organs are functioning all right to start off with. And then throughout their treatment, say every 3 to 6, maybe even 12 months, we check them, maybe take some bloods to ensure that their kidneys and liver are still functioning okay and the drug isn't harming them. If on a checkup we did notice that something was changing inside, that perhaps internal organs weren't coping with the medication quite as well as we'd hoped, we might discuss how we can go forward with this, whether that be to continue on the same medication and take the risk actually that maybe it will affect things, but his quality of life is so much better on the medication, it's worth it, or whether we think about moving on to a different type of pain relief that perhaps isn't quite as good at managing the arthritic pain, but has less side effects.
We did discuss side effects when I spoke to the vet, and they did do a kidney function test just to get a baseline of what his kidney function is at the moment. We talked about it, me and my husband, and really I feel that if he's going to have a happier life and he's going to be not in pain and he'll be able to move more freely, then I think that that's worth it. He is 12, so he's had a brilliant life, so I'd rather he was happier and he could move freely and enjoy the life that he has. If that does mean that it may be shorter, then that's a consequence, but he's had an excellent life, and I just feel that it's worth it really for him to not be in pain. I wouldn't want him to be suffering and not be fit like he is now. It was quite surprising, the difference of him having the anti-inflammatory from how he was before, and then that made me feel that maybe he was in pain before, which was a concern really as an pet owner. I think when you start a course of treatment with an animal or your dog, you do have to think about the cost of it. I think that it's worth it. So we kind of started and thought, well, we'll see how we go. The improvements in him make it worth it. I guess you just have to put it into perspective with other things that you buy around the house, whether you go out for dinner or, he is worth it. So it's made a difference. The vet did recommend some different treatments, and hydrotherapy was one of them, and physiotherapy. It's not curing the problem, so we just need to be mindful that even though he's like got a second wind and he's quite happy again, we just need to be careful not to overdo it with him. He seems to have made good progress and he seems to be quite happy and enjoying life again.